Hello, and welcome to the Alabama Public Health Training Network. One of the most effective preventive measures that a mother can take to protect the health of her infant as well as herself is to breastfeed. Today we will discuss tools for clinicians that will assist in providing excellence in their endeavor to promote and support breastfeeding in their patient population. Thank you for joining us today for our program, Maximizing Breastfeeding Outcomes, How to Help Mother and Baby in the Outpatient Setting. Please note that the speaker today, Glenda Dickerson, and myself, Gail Watley, do not intend to discuss commercial products or services. We do not intend to discuss non-FDA approved uses of products or providers of these services, and we do not have any relevant financial relationships or affiliations related to this topic. If you have a question about anything being discussed today, please call or email during our broadcast. The phone number and the email address are on your screen now and will appear again later in the program. Also, the handouts, the sign-in sheet, and the evaluation are all available online. You'll need to register for this program in order to access these materials. Continuing education credits have been approved for nurses and social workers for today's program. In order to receive credit for this training, you must watch the entire program, then complete and return the sign-in sheet and evaluation. While content may continue to be relevant, the CE credit will only be awarded for 1 year and will expire on December the 31st, 2015. Application for CERPS has also been made, and anyone interested in receiving CERPS credit should contact me at gail.watley@adph.state.al.us. I'm Gail Watley, Region 3 Perinatal Coordinator, and with me is Glenda Dickerson, Women's Support Services Manager at Brookwood Medical Center in Birmingham. Glenda?
Thank you, Gail. This is part one, and what we'll be talking about is Foundations of a Baby-Friendly Office. Our objectives are listed in your handouts, and the one that we're going to go over right now is just the important elements of a written breastfeeding-friendly office policy and the things that go along with that. So refer to your objectives for a complete list of objectives. Before I get started, I want to talk about where we are now in Alabama with breastfeeding. The CDC started publishing a breastfeeding report card in 2007. And in 2007, Alabama's breastfeeding initiation rate was 52.1%. In 2013, our latest report card shows that we have gone up about 8 percentage points to 60.4%. It's our duration rates that show our greatest opportunities. We have risen 8% in our initiation, but when you look at our duration rates and comparing 2007 and 2013, our increase has been minimal. Between 2007 and 2013, our 6 months duration rate was 25.4%, and we are now at only 29.5%. For our 12 months duration rate, we were at 11.5% in 2007, and we're now at 14.2%. So the amount of increase that we've seen in duration has not matched what we see in initiation. Healthy People 2020, those goals, which are national goals set forth by the Surgeon General of the United States, our goal for 2020 is that breastfeeding initiation in the United States be at 82%. In Alabama, we have several percentage points to go, 22 percentage points to go. With our 6 months duration, the Surgeon General has a 61% goal. Alabama is only at 29.5%, so we have to double that rate. Our 12-month duration rate, the Surgeon General would like to see the United States at 34%. Alabama is only at 14.2%, so once again, we have to double that rate. So duration is an issue that we have. As far as exclusive breast milk feeding, which we're going to talk a lot about in the next 3 sessions, the Healthy People goal is that at 3 months, 40% of our babies be exclusively breast milk fed. In the United States, we're currently at 37%, and in Alabama, we are only at 23.5%. Our 6-month exclusive breastfeeding rate, the Healthy People goal, is 17%. When you look at the United States as a whole, they're almost there, but Alabama lags behind at 9.1%. And when you compare that to our 2012 breastfeeding report card, you can see in parentheses that we've actually gone down slightly in our exclusive breast milk feeding rate. So we have a lot of work to do in our state. it. So when we look at the baby-friendly office setting, whether it be a pediatrician's office, an obstetrical office, or a WIC office, anyone who cares for moms in an office setting, there are several things that we can do to facilitate those moms to make the decision to breastfeed and to give her the information that she needs to decide to exclusively breast milk feed. The baby-friendly office is an important safety element for that mom. It provides her with that safety net so that if she is in a culture that's not supportive of breastfeeding, there is someone that she can turn to have questions answered, to give that positive reinforcement that she needs so that she feels good about what she's doing. And a breastfeeding friendly office can go a long way to do that. So let's talk about what we know about how to support moms with breastfeeding. Well, the American Academy of Pediatrics recommends the World Health Organization 10 steps to successful breastfeeding, and these are specific to hospitals, having a written policy, training staff, telling moms about the benefits and management of breastfeeding, helping them initiate breastfeeding within that first hour, showing them how to maintain lactation even when they're separated, giving newborn infants nothing else to eat or drink except breast milk unless it's medically indicated, rooming in, encouraging breastfeeding on demand, giving no artificial nipples or pacifiers to breastfeeding infants. All of these things, including supporting or fostering the establishment of support groups, all of those things play into getting that mother off to a good start. So we know that the Baby Friendly Hospital Initiative provides that framework for helping moms acquire the skills that they need to exclusively breast milk feed, and it's specific to the hospital. But how does that connect with having a baby-friendly office or a breastfeeding-friendly office? Well, the scientific basis of many of those recommendations are evidence-based. They are evidence-based recommendations, and they can be extended into the outpatient setting. So what is a breastfeeding-friendly office? Well, we have roadmaps to get us there. We don't have to guess what an office should look like when it's breastfeeding-friendly. We've got ways that we can go to the literature and we can find out exactly what we need to do to have that kind of office. One of the ones that's out there is the Academy of Breastfeeding Medicine's Clinical Protocol number 14, and the title of that protocol is actually Breastfeeding Friendly Physician Office, Optimizing Care for Infants and Children. The AAP also has an article out on how to have a breastfeeding friendly practice, and then the AAP has also recently put out 10 steps to support parents' choice to breastfeed their baby. So we've got several guides for us when we're looking at what kind of office should be run in order to be breastfeeding friendly. The foundation of those efforts should be a written breastfeeding policy that has been looked over after staff has been educated and after some education has been received by the staff in that office and by the administration in that office. And then there should be a time that that policy is developed collaboratively among the staff so that there's an opportunity to talk through some of the issues, some of the biases, some of the misconceptions that people on staffs will have about breastfeeding. And the evidence can be looked at, and because the evidence can be looked at and gone through, then those things can be put aside as far as personal thoughts about breastfeeding or personal biases and misconceptions, and they can move on to an evidence-based policy. Another reason for having a policy is that people come and people go in offices, and there's always turnover in any kind of work setting that you have. And this helps to keep everyone on the same page. When you have someone new and coming into an office setting, to sit them down and say, here's our breastfeeding policy, and have them go through it and know exactly what the expectation is as far as how they care for breastfeeding mothers and the atmosphere of the office in relationship to caring for breastfeeding mothers. And then when an issue comes up, you can refer back to the policy. It no longer is just somebody's opinion that this is the way we should do this, but there's an actual policy in place. So I think the only way to approach having a breastfeeding friendly practice is to first come up with a policy and to look at the literature and to decide the things that need to go into that policy. That policy should provide guidelines. It should tell us and tell that office how to effectively promote breastfeeding. And then the care practices that should be supported in hospitals and also the care practices in office settings that help to protect that mother in her efforts to breastfeed. And then the follow-up care is so important as far as an office setting is concerned, because knowledgeable and skilled care needs to be written into that policy. How are we going to handle this? Who's going to answer questions about breastfeeding? What kind of education should that person have? So the promotion, protection, and support should be written into that policy. What I'm going to focus on is we're talking about some of the things that an office can do is the AAP 10 steps to support parents' choice to breastfeed their baby. So let's just go through a few of those. And if you look at your handouts, I've got them all written out together on the next couple of slides. And then let's go through them one by one. Number one in any policy is just to make the commitment that breastfeeding is important. The American Academy of Pediatrics recommends that all babies are exclusively breastfed for around 6 months, and then with the addition of complementary foods for at least a year, and as long thereafter as is mutually desired by the mother and the baby. So when you communicate to staff, this is our recommendation. We are recommending, because of the importance of breastfeeding, we are recommending that this is what moms do. That takes away the personal bias of, well, how long do you think I should breastfeed? And someone says, well, you know, I only breastfed for 3 months, or I breastfed for 9 months, or, well, you know, just as long as you would like to. That gives a standard that moms are informed of so that they know what the American Academy of Pediatric recommendation is. And that comes from training all staff in skills necessary to support breastfeeding. At least one person in the office should be identified as a resource person so that that person can focus much of their efforts on acquiring those skills to give advanced breastfeeding management. In other words, that person should be the person that really has a good deal of input into the policy because they've done the background work on finding out ways to help breastfeeding mothers and going through the literature and finding out what the information is and resources that should be used. After that resource person is identified, then a telephone triage with protocols on, what are the right and the wrong things to do as far as breastfeeding advice is concerned, how you manage things about medication, when a mom calls in about a medication. That person needs to be the one that helps to develop that telephone triage and that trains other people to ask questions when that person is not available. And then just informing all women and families about the benefits and management of breastfeeding. And if this is a pediatrician's office, a lot of times they don't have the opportunity to sit down one-on-one with the patient, but they can encourage prenatal breastfeeding class attendance. The other thing that can be done is to offer prenatal visits so that parents can come into the pediatric office. Or if this is an obstetrical office, moms there can all be told about the benefits and the management of breastfeeding and just some of the basics things about breastfeeding that we're going to go over during our time together today. Number 4 is to assess infants during early follow-up visits, and that's 48 to 72 hours following discharge. And that's a recommendation both of the Academy of Breastfeeding Medicine and the American Academy of Pediatrics. This gives the practitioner the opportunity to evaluate for breastfeeding adequacy. Are things going well with feedings? And then also a great time to educate parents. In our facility, we call all of our mothers back at least one time after they leave the hospital. And just that first night at home, so many things come up that they didn't think about in the hospital. Their milk has started to come in. Everything changes about how their baby is breastfeeding. What I tease parents about when they're about to leave the hospital is I'll say, the baby that you put in your car seat on the way home is going to change. I think it's something about the car seat, but they've been sleepy here in the hospital. All of a sudden, they're going to be awake, and they're going to be telling you exactly when they're hungry. And so this is a great time because now they've actually lived through a night at home without a healthcare worker there with them, and it's a great time to answer all the questions that they have that have come up during that period of time at home. So 48 to 72 hours after discharge is the recommendation. And then encourage those moms to breastfeed on demand. There is still a lot of old wives' tales or old advice out there about let's put babies on schedules and let's only feed babies a certain number of times a day. And if your baby is wanting to eat more often than that, then maybe there's something wrong with your milk. Maybe your baby's hungry because there's something wrong with your milk. Well, mothers need to be reminded that it is normal for their baby to feed about 8 to 12 times in a 24-hour period during the first days home from the hospital. And so that's a great time to reiterate that when they come in for that early visit, because for the first time probably since they've left the hospital, they have started experiencing those 8 to 12 times a day. And now they're under the stress of not getting a whole lot of rest and being on their own with their baby. This is also an opportunity when you are writing your policy and when you are developing the protocols that you have, is to make sure that you have information in your office on how to advise moms to maintain breastfeeding even when their babies are away from them, such as an intensive care mom, a mom whose baby is in the intensive care unit. If someone were to call your office with questions about, well, how do I go about pumping? What do I do about milk storage? Do you have the protocols in place about that? Do you have the information in place to give moms information to answer those questions that they'll have about milk storage and how often to pump and how to transport their milk? And then also the working mom. Many times mothers will take off 6 weeks, 3 months, whatever amount of time they are able to take off. And they will come to the pediatrician's office maybe for their 2-month checkup and say, I'll be going back to work in a couple of weeks. What should I do as far as storing my milk and pumping when I get back to work? And is there any kind of advocacy for moms as far as working moms and their right to pump at work? What are some of the things that you can share with them on that? Number 7 in the AAP list of 10 is to just have appropriate anticipatory guidance. And what that means is that we should not wait until their baby is 6 months old and say, oh, by the way, we recommend that you breastfeed for about a year after you start adding in food, that you breastfeed for at least a year and as long as you would like to and the baby would like to after that. They need to be informed of the American Academy of Pediatric recommendation on how long to breastfeed their baby early on, so that they are anticipating that being a goal that they have, not being told about those goals later. And then to be ready for the questions that are going to come about when a mom comes in. Does everybody in the office know how to answer a mom when she says, why is my baby nursing so often? Just for the last couple of days, he's nursing every hour and a half to 2 hours again, like he did when he's a newborn, and he's 3 months old now. What's going on with him? Do they know that that's a growth spurt? Do they know that stopping breastfeeding and starting formula is not an automatic on making a baby sleep all night long? Because sometimes mothers are getting that information and they're being told, if you'll stop that breastfeeding, your baby's gonna sleep all night long if you'll go to formula. And then when they have complaints from their mom or from their grandmother, oh, he's not big enough. He looks like a thin baby to me. It's so funny to me how this is the only time in life that we admire someone being a little overweight. We think that, quote, fat babies are cute babies. And so questions about, well, is he growing the way he should? He's not as big as my neighbor's baby, who is a formula-fed baby. Well, breastfed babies tend to be longer and leaner by weight, so they don't look as chubby as formula-fed infants do. Number 8 is to support breastfeeding by providing accurate information about maternal issues. When a mom calls into the office, does the office staff know to say, if she says, I've got a temperature of 102, should I continue to breastfeed my baby? Does your office staff know that answers the phone that there are very few contraindications to breastfeeding, and that list of contraindications should be in front of them so that they can ask intelligent questions about those illnesses and then give the appropriate information and not just guessing about what's okay and what's not okay. And then, do you have good resources for medications? Thomas Hale's Medication in Mother's book is the gold standard on what medications are compatible with breastfeeding. And then there are also some free apps that you can get for smartphones that are by the United States government. And those apps give quality information on medications and whether or not they're compatible. And then some of the funniest questions that we have had have been about dental procedures. I'm going to my dentist today to have a dental procedure done, and he's going to put my, I'm going to have a cavity filled, and he's going to numb my mouth. Is that going to affect my breastfeeding? Do they know that local anesthetic does not impact breastfeeding at all. And then, of course, about the contraindications as far as illicit drug use is concerned. So just having accurate information on those issues. And then when a mother walks into an office, what does she see in that office environment? Does she see pictures of babies breastfeeding? Or does she see pictures of baby bottle feeding? Is she given free samples of formula? Are her problems trying to be solved by somebody giving her a bottle of formula while she's in the office? And then expanding that network and support for breastfeeding. Those referral sources in the community. Do you know people to refer moms to? Do you know their background? Do you know their training? Have you had conversations with them about their philosophy on what they do in certain situations? If you send a mom to a referral source like a board-certified lactation consultant, how does that person handle weight loss issues or inappropriate weight gain issues? If a baby's not gaining enough, they're gaining very slowly, how would they handle that? And so just expanding that network of lactation support in the community, it's so important to know who you are sending that mom to and what their philosophy is and whether or not they're going to provide quality care. The support, the Affordable Care Act, does list lactation services and supplies as a reimbursable service, and they say that it should be at no copay for the mom. So the services of a lactation consultant can be billed under a physician provider number. The Affordable Care Act does not look to add providers, but what they are doing is using current providers, such as physicians, as ways that lactation services can be billed for. And so many pediatrician offices are not aware that if they had a lactation consultant on staff, they could bill for that lactation consult so that that care could be given right in their office. And as a matter of fact, the Affordable Care Act many times is being interpreted through the United States Breastfeeding Committee model policy on reimbursement. And what that model policy says is that the delivering hospital cannot be reimbursed for that kind of care. And so the best place to provide that care is through the physician's office many times, so that if a mother needs to come back in on an outpatient basis, she will have a source for that to be done. There is a coding guide that pediatricians can go to that can show them exactly how to code for those kind of services through their offices. And then another part of support is having a stock of supplies for moms. When they come into your office and they're having an issue, many times insurance practices will allow you to charge those breastfeeding supplies to the child's bill. Even if the mother is not registered as a patient to that pediatrician's office, it can be put on the infant's bill in the pediatrician's office. So just having a stock of those supplies will help moms coming in for that 48-hour visit. They need something, and this will save them a trip to the drugstore or having to go to another kind of store that might stock these kind of supplies, and particularly for looking around for places that have those supplies. So just having a supply in the office for that mom is going to be very, very helpful to them. So in a nutshell, what should a breastfeeding friendly office look like? Well, number one, it should support the American Academy of Pediatrics recommendation that all babies are breastfed for at least a year. And then it should explain to every patient that breastfeeding and formula are not equal, and that breastfeeding is the best choice for the first year and beyond. All formula marketing should be removed from the office. That's not a place that formula marketing should take place, because what that indicates is that that practice is supportive of formula being used for babies instead of breast milk. And then pictures and posters that support breastfeeding, so that this becomes a normal part of our culture to see a woman breastfeeding. And using pictures of women breastfeeding rather than using pictures of moms bottle feeding is one way to support that change in our culture. And then all healthcare providers on staff that have any contact with a mother at all should work towards having an increase in their breastfeeding knowledge by the kinds of conferences that they attend, the education that they get right there in their office. Those things should be a normal part of just what they do on an everyday basis, is finding out more and more and more to help moms with breastfeeding by increasing their knowledge. And then having current breastfeeding references available. There are many good references out there. And just having the most current and the ones that are going to be the most helpful. And then knowing your breastfeeding referral sources in your area. And then collecting your data on what your breastfeeding initiation rate is and on what your duration rates are. If you don't have that information, if you don't know what your population is doing, then you don't know what you need to work on. And I know in my healthcare setting, we know what our breastfeeding initiation rates are. And right now, we're currently running a 90% breastfeeding initiation rate, which is wonderful. But our duration rates are not where the Surgeon General would like for us to be. So those are the issues that we have in our area. And if we didn't collect data on breastfeeding initiation and breastfeeding duration, we probably would think we still need to be in physicians' offices putting up posters about you need to breastfeed your baby. That's not where our focus needs to be. Our focus needs to be on how long moms are breastfeeding and what we can do to provide them with the support to help to facilitate their breastfeeding longer than they currently are in our practice setting. So that in a nutshell is what a breastfeeding friendly office looks like. And that's the end of part 1.